we've talked in the past about a lot of really less than optimal outcomes with some of the other aligner companies. One of the things that I hear so frequently is dentists getting their patient close to the end of treatment, but for some reason, they're unable to finish. They're unable to really get it to the very end. And what they end up doing is really having to eat another lab cost by trying to switch and experiment with another aligner company. And posterior open bite is not an uncommon outcome. What's been your experience with that, and what do you do, and what does Clearly do to avoid that posterior open bite as an outcome?
Well, yeah, I think it's an interesting question, and I know that you have told me that when people started complaining to or talking to you about posterior open bites, it seemed foreign because you just hadn't heard of clearly doctors talking about it. Am I right? Like that was a foreign thing to you.
Yes.
At first, because yeah. So, you're right. In the past, posterior open bites were a significant issue, and again, I think it comes down to the fact that people moving the teeth in a cartoon aren't the ones that are actually dealing with the outcomes, and they might not understand, without getting too technical or snooty. They just don't understand the muscles of mastication. They don't understand how the lower jaw is going to respond to certain movements. They don't really get the full pictures, right? So just because you can make a teeth look good on a cartoon, or you can move the jaw around in a cartoon, doesn't mean it's going to translate into real life. And you just have to understand the types of tooth movements or common interferences or problems that occur with aligner movements. And you have to have done it enough to know how to move the teeth virtually to avoid them. And I think that every orthodontist involved with Clearly has such extensive, experience, again, with having successes and failures and doing it, and have done things like cut the aligners, distal to the canines to try to get some settling, and, put in, bite plates and things like that because they just couldn't figure it out. But once you figure out the types of tooth movement, and there's a couple of different things that we do, and again, I won't bore everyone with the actual tooth movements, but they're eliminated. I mean, the idea of having a posterior open bite at the end of aligner treatment is no more, at least with Clearly, or someone who's got extensive understanding of how to treat patients with clear aligners. And unfortunately, or fortunately, anyone can use aligners, which is great. I think that's fantastic. But if you don't have the experience and the failures on how to get around them, then you're going to experience that in your own clinic if you're doing your own design, or you're having a technician or some artificial intelligence doing it. Even if you get coaching, if you buy an aligner or a system and then you pay for more coaching, until you get that particular patient experience, you're not gonna know, and it's gone. So it's not something we deal with anymore.